Good evening, everybody. I'm Professor Manokar from Chennai, a cardiologist. I'm here to discuss with you the impact of exercise with respect to cardiovascular diseases and how this has an impact on terms of outcomes, in terms of disease prevention and disease treatment. Can we go to the next slide? uh, Lifestyle changes are very important in treating heart diseases. So actually, lifestyle changes doesn't involve just exercise; it involves multiple aspects, and one of the key aspects is exercise. So I'll skip about my discussions about alcohol, smoking, weight reduction, and diet, and all those things today. Today, I'll stick to exercise alone, and we'll keep that as the topic of today's discussion. Next slide. So if as a person, if you want to know the risk, so what is the risk, so what is the benefit of doing exercise? So if there is one slide I want everybody to concentrate today and take home as a message, is that patients who do regular physical activity, they reduce the risk of heart disease by 35%, risk of diabetes by 50%, and most importantly, look at the cancer risk. The risk of colon cancer by 50%, the risk of breast cancer by 20%. In general, the early death risk is reduced by 30%. And look at the reduction in the orthopedic fractures, risk osteoarthritis, risk of falls, and even things as remote as dementia and depression. So psychiatric problems, all these things can be significantly impacted by regular physical activity, and that is why it is not just heart disease, it's every aspect of your life can be affected if you do regular physical activity. Next. So this is a slide more of regarding how, in what all manners that physical activity improves the heart, whether it is psychological, whether the reduction in the arrhythmic events, the reduction in the clotting tendency, reduction in cholesterol, reduction in blood pressure, so many things. I don't want to bore you with this kind of a theoretical slide, but the concept is the impact of physical activity in heart disease is from multiple aspects. Next slide. This is even more a busy slide trying to say that how so many things can be affected just by changing the physical activity level of a given patient. Next. So this is just to show how much impact that has on exercise. So there are a lot of things to be understood in this slide. If you look at the patients who have no physical activity versus the patients who have a lot of physical activity, and the same way the patient with high risk of heart disease and low risk of it. So this is a curvilinear relationship. As you move down the flow, the risk reduces, and that is why I will come to how much exercise is important, because the sweet spot where the benefits of exercise are maximum to the general population. We'll discuss that at the next level. The point is, as you exercise more, you benefit more, and that's why this slide is there. Next. The American recommendations for people with heart disease. Next. This is, I'll go to the British recommendation because it's more better understandable. Basically, this also insists on at least 30 to 60 minutes of brisk walking, 5 days a week, preferably 7 days a week. And also there is a lot of supervision, rehabilitation. This is a class 1 recommendation. But I think I will shift to the British recommendation because that makes a lot of practical sense. Next. This is the more or less the point that I was discussing in the previous slide. That is, as soon as you start exercising, when you do something like 8.25 minutes of exercise per week, almost 70% of the benefit is achieved. That is 150 minutes of moderate physical activity. If you do, almost 70% benefit is achieved. Beyond that, the benefit occurs, but the degree of benefit, as you see, that the graph is kind of plummeting and plateauing, and that's why exercise beyond that doesn't cause harm, but doesn't cause major benefit. So that's the reason this graph has been mentioned, and this is not just with respect to heart disease; it's with respect with all-cause mortality. Next. So the important is the beneficial effect has no threshold. If somebody says I can walk only 10 minutes, I can walk only 20 minutes, no difference. Any level of physical activity is better than doing nothing. So there's nothing like a best amount. The more you exercise, always the better. There's no apparent threshold. But as the slope is steepest in lowest amount of moderate, and 70% of benefit is achieved, what I mentioned earlier, with 8.25 minutes of physical activity, and that is more or less what we are trying to aim with this advice. Next. So we very interestingly, why I put everything in this slide is almost similar to the previous slide, but why I put it up is, if you look at colon cancer and breast cancer, which we assume has no relationship to physical activity, even those conditions, the risk with moderate activity, something around 4 kind of level of activity, also the risk reduction is achieved. So whether it is diabetes, whether it is ischemic heart disease, stroke, or other condition where you think exercise will help, even in other conditions also, this little degree of exercise makes a huge impact on outcomes.